Hey guys, imagine being in a hospital room with three different nurses. One is checking your vital signs, another one is managing your care plan, and the other one is writing your prescriptions. Do you know who each one is? Understanding the differences between these professionals isn't just helpful for anyone going into the medical field, but it's also essential for patients and families to know who is caring for them and what to expect. The nursing profession is a very diverse and complex field that is always evolving, so the differences between nursing roles is becoming more important than ever. While all nurses play vital roles in patient care, licensed nurse practitioners, registered nurses, and nurse practitioners differ significantly in their education, responsibilities, and authority within the healthcare setting. Today, I want to inform you all on the roles and responsibilities of all the individuals you might meet in your hospital room: licensed practical nurses, registered nurses, and nurse practitioners, explaining how their education, responsibility, and levels of authority differ, and how each plays a unique role in your healthcare. To better understand the differences between LPNs and RNs and MPNs, it is important to first look at what you got them here and where their differences originally started, which would be their education and training. The educational path is going to vary significantly with each different nursing level. As you go on up the ladder, they start to require more training and specialization, as talked about in the article. Types of nursing and what they do by nurseworld.org. There is already a big difference between the education needed to become an RN over an LPN. As stated, an LPN must have a high school diploma or a GED and then go on to complete an accredited practical nursing certificate program. These programs usually take about 1 year to complete. After finishing the necessary training programs, they must go on to pass the National Counselor Licensure degree in nursing or a 4-year Bachelor of Science in Nursing. Sometimes RNs can be licensed through different approved programs such as Accelerated Bachelor of Science Nursing. After completing this necessary education, all registered nurses must pass the NCLEX RN exam so that they can receive their license. Lastly, after successfully completing their exam, they must hold up-to-date credentials per the Board of Nursing in their state. In this article, they also proceed to tell us that NPS must be registered nurses and have either a master's degree or a doctorate in nursing. After obtaining these two things, they must pass the National Certificate Examination, and this certification will correlate to at least one specific type of healthcare. Ultimately, the education journey for each type of nurse lays the foundation for their professional responsibility, defines the scope of their role within the healthcare system. With their varying levels of education, it's no surprise that each type of nurse also has a different set of responsibilities and scope of practice. Goodwin University wrote an article titled LPN vs. RN Similarities and Differences that highlights the differences between the responsibility and the scope of practice of LPNs and RNs. LPNs will usually provide a more basic, ensuring basic comfort. And this means that they will help with basic tasks such as vital signs, ensuring basic comfort, and bandage changes. There are multiple other basic duties that they will perform. They've been trained in and are okay with the nurse that they are working underneath. On the other hand, RNs are responsible for most aspects of patient care. This includes setting up of treatment plans, administering medications, and teaching patients about their post-op care needs. Their license provides them with a great knowledge in their careers, which gives them ability to complete these tasks. Lastly, NPS offer a wide range of healthcare services and can perform all the tasks LPN and RNs can perform, but more. For example, they must diagnose patients, prescribe medications, and help educate and counsel patients and families. Being an NP allows you to so many different scopes of practice to choose from. This distincts in scope of practice make each role uniquely valuable to healthcare team. Beyond just their responsibilities, another important difference between LPNs, RNs, and NPS lies in how much independence they have, and they are allowed to work. Along the responsibilities, each nursing role also differences in how independently they can work and the types of healthcare settings where they are typically found. In the information article called LPN Scope of Practice that was published by the Kentucky Board of Nursing, they discussed the difference between the scope of practice of LPN and RNs. Out of these different nursing roles, LPNs are least independent out of all. They function at a very different level because they work underneath anyone, really, such as registered nurses and physicians. They also are allowed to work in various healthcare settings like hospitals and doctors' offices, but unlike LPNs and RNs, function in a way more independent level in dealing with a lot more responsibilities. Also, now they're similar because neither of them can independently practice other products or prescribe medications. They also are allowed to work in any type of healthcare facility. In another article by American Association of Nurse Practitioners that was titled Scope of Practice for Nurse Practitioners discusses the scope of practice and the different responsibilities that they have. The independence level and work setting depend on the state that you are wanting to practice in. This is due to the fact that some states do not let NPS have their own practice, but in some they're allowed to in their own independent practice. This variation in independence in working settings highlight how each nurse role fits into the broader structure of patient care. In conclusion, the roles in licensed practitioners, registered nurses, and licensed practical nurses differ greatly in terms of education responsibilities, independence, and work setting.